From the ONS perspective, we wouldn't say we would tell you to use one or the other. Kind of goes back to, do they meet kind of that same set of criteria? Are they supported by good evidence? Is it relevant information? Those are the things that you want to be kind of evaluating them both with. That said, going back to the point you made earlier, some institutions say no branded patient education resources, no branded anything within the organization. So the other kind of caveat to that I would throw out there is for nurses to make sure that they're looking at their institution-specific policies, particularly probably surrounding more patient education resources and whether they can be using branded resources or not.
You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS. Today, we're talking with Chelsea Backler, Oncology Clinical Specialist at ONS, about non-branded and branded educational resources for nurses. You can also earn free NCPD contact hours after listening to this episode and completing the evaluation we've linked in the episode notes. Thanks for joining me today, Chelsea.
Absolutely. So happy to be here.
As nurses, besides taking care of patients, one of the biggest things that we do is educate patients. Whether we are working in a large hospital system or in a small practice somewhere, the importance of knowing what good educational materials are for our patients, whether that's about their diagnosis or about the treatment they're getting, is something that all nurses need to know and need to understand how to find good, reputable information to be able to give to their patients. So can you explain to us today, just to start us off, what is the difference between branded and non-branded educational resources?
Sure. Branded resources are really going to be those resources that are focused on a specific product, its indications, like certain medication, an IV pump or an IV catheter. Those are going to be more so what a branded resource is focused on. Non-branded resources aren't really going to focus on, again, any specific product, any specific medication. These are resources that are going to be more focused on broad topics. So common symptoms, psychosocial support, disease-specific education. So a good example of this would be a newly diagnosed metastatic breast cancer patient. What are things I need to make sure that I know before I start treatment, or what are good questions for me to ask my care team? So kind of those bigger, broader resources that don't have a focus on specific medications or specific products. That's really the biggest difference between the two.
Okay. Our listening audience, a lot of times, are new nurses to oncology as well as new nurses out of school. So when they are just getting started or working with their patients, how can they identify if a resource is branded or non-branded?
I think sometimes it can be confusing because sometimes when you think about branded, you're like, oh no, it's got a company's name on it. So then that must mean it's branded. But that's not always the case. So really, the easiest way I would say is to be looking for those specific mentions of a product or a drug in the resource. That's going to help you identify if it's a branded resource. So non-branded resources, those kind of bigger umbrella topics, they certainly might have like a company logo, like a pharmaceutical company logo on it, but that's more identifying who is funding or providing the resource, not necessarily indicating that it's a branded resource. So really trying to pinpoint if it's talking a lot about a specific product, it's talking a lot about a specific drug, that's going to be your first indicator that it's more than likely a branded resource.
That's good to know. And you're right, it can definitely be confusing. Like you mentioned, if it has a company name on it, then that might be something that you would automatically think and be concerned about, or just not sure how it can be used. Because in institutions, it's really important to know what types of education are permitted to be used with your patients. And so sometimes there are regulations on what kinds of things nurses can provide to patients and where they can actually get those educational tools from. Let's say that I am getting ready to teach my patient about their new diagnosis of AML. How can I use what we're talking about, branded or non-branded educational resources with this patient?
I think there's a few different ways, certainly, to incorporate the different types of resources. I mean, ultimately, certainly you're starting with what does the patient need to know? What are their knowledge gaps? What are they most in need of? Are they ready to learn? All of those things that we're assessing up front. Once you kind of determine, okay, here's the areas that I need to pinpoint, branded or non-branded, I think then there's resources out there for you to utilize. So there's so many out there that I think nurses aren't even aware of, like disease-specific education. So I think I mentioned before about like a newly diagnosed breast cancer patient. There's more than likely education out there for a newly diagnosed AML patient. What are the key things I need to know going into treatment? A lot of them will provide you with scripted questions to take in as a patient or a caregiver to visits with your care team to say, these would be good things for you to ask, and even have space for you to take notes. On the flip side, when we talk more about branded resources, those can certainly be helpful too. Like, if you have an AML patient who's starting on a very specific drug, finding those branded education resources about that drug aren't necessarily bad resources. If they're balanced, educational, supported with good evidence-based references, those can be excellent tools for you to utilize to educate your patient, particularly in institutions that maybe don't have lots of homegrown education, where they don't have teams of people to make up all of the different documents to give patients. These are out there, and they might be a good resource for nurses to add into their repertoire when they're teaching patients. The other thing I'll say too is there's resources for nurses and for caregivers specifically. So patient-specific education aside, I've seen educational resources that talk to the caregiver about how to take care of themselves and, manage their questions and concerns and how to support the person with cancer. Same for nurses. There's topics that range from burnout and compassion fatigue to disease-specific education that's geared specifically towards the nurse. So there's just such a wealth of educational resources out there that could really aid the nurse in so many different situations, either providing education or looking to educate themselves.
So Chelsea, as a nurse is deciding or looking for educational materials, and like you mentioned, it could be for the nurse, it could be for the patient or for the caregiver, what kinds of things should they look for in materials that they find that are going to show that it's really evidence-based information that is reputable to use?
Absolutely. Yeah, that's a big question that you want to address before you decide to use a resource, right? Is the content being supported by relevant evidence-based references and content? So I think the tricky part sometimes with some of these resources, especially patient-facing resources, is they're not always providing the references because it's patient-facing. I really hope we do see a change in that, because I feel like our patients and just kind of consumers of healthcare are getting much more savvy in identifying and wanting to know, well, where is this information coming from? Other than, okay, this is the company logo that's on it, but I want to know what's behind the information. Like, where are they getting this information from? So I'm hoping that that starts to shift, and sometimes you will see it, but really then maybe more so with those resources that are focused more on the healthcare provider or the nurse, really you should be seeing references annotated in the resource itself. So having that little like superscript number at the end of a sentence, and then you go to the bottom of the page where it'll tell you, here's the reference to support this statement. And the references themselves, you kind of have to evaluate, does this look like it's coming from a reputable resource? Places like the National Comprehensive Cancer Network, the American Cancer Society, ASCO, ONS, places that you know and trust have a process for developing their resources, education information. You always want to be wary of .com type websites that are supporting things. Not to say that that's bad information, but you always want to kind of evaluate whether you think that that website is reputable, if there's a reputable organization behind it running it, that sort of thing. The other thing you want to look for is, how old are they? cancer care changes so fast. We all know that really, really well. Things change day to day. So, if you're seeing references that are really out of date, I kind of always joke, like, if I was still in high school when this reference came out, probably needs to be updated to something else. Or if I was still in college when this came out, really, you're ideally looking for references within the last 5 years is generally what we say at ONS and what we try to strive for. And especially if it's an area of oncology, like think about immunotherapy, that changes so fast and it's been so rapid the last few years. If you're seeing really, really old years on references, that might be a little bit of a red flag, whether this is really relevant content that you're seeing.
Thank you. I think those are really great points and just important information for new nurses and just as a reminder to folks what to look for. So can you tell us, do you think that there is a preference in using branded over non-branded resources when it comes to patients with cancer?
Yeah, I think this is a big question for a lot of nurses. It's like one better than the other. From the ONS perspective, we wouldn't say we would tell you to use one or the other. Kind of goes back to, do they meet kind of that same set of criteria? Are they supported by good evidence? Is it relevant information? Those are the things that you want to be kind of evaluating them both with. That said, going back to the point you made earlier, some institutions say no branded patient education resources, no branded anything within the organization. So the other kind of caveat to that I would throw out there is for nurses to make sure that they're looking at their institution-specific policies, particularly probably surrounding more patient education resources and whether they can be using branded resources or not. That would be kind of the only distinction that I would really say.
Thank you. So ONS has a seal of approval program that helps oncology nurses find educational resources. Can you explain how that program works?
Yeah, absolutely. So seal of approval program is something I've been involved with since I started here at ONS. So I've been with it for a little over 4 years now. And really what the program is meant to do is to help oncology nurses, other healthcare professionals, and healthcare consumers like patients and caregivers be able to more easily select quality educational resources related to cancer care. The seal, which actually shows up like a little, what you would think of like an embossed seal on a letter or something like that, shows up on the resource once it's been approved and hopefully kind of essentially helps the reader quickly identify that, oh, ONS has put their seal on this. I know ONS puts out the quality standards and guidelines and education that they put out. I know what they uphold. If they put their seal on it, this must be a high quality resource and something that I can review and see if it would be helpful for my practice. So it's really trying to kind of take some of the legwork of evaluating that resource off the nurse or off the consumer, because we've done that for you in some ways, and then put our seal on it to kind of help you quickly identify this resource has been reviewed by ONS and has their seal of approval.
So you are the one that reviews and approves these resources?
So it's kind of a two-step process. Initially, the resource, so it gets submitted through our business development department here at ONS, and their staff essentially go through it and make sure that it even meets the criteria to be submitted into the seal of approval program. So they look at just different things like how long it is it educational in nature, and then whoever's submitting the application or submitting the resource for the seal has to complete an application answering certain questions. And the business development person will kind of look at all of those things, make sure it kind of checks all of the boxes for them. And then they'll send it over to an oncology clinical specialist on the clinical team here at ONS for additional review before it can be approved for the seal. And mainly what my job is looking at that clinical content in the resource.
So now let's talk a little bit about the types of resources that are submitted to ONS to be considered for our seal of approval. Can you talk about that a little bit?
Yeah, there's a wide variety of resources that we see come through that apply for the seal. So it can be anything from the slide decks that are used, educational presentations for nurses, like a lot of chapter programs and things like that. Could be like a one-page resource for a patient or a caregiver, all the way up to like larger pamphlets or booklets that are used by the nurses or the provider team to provide education to patients or to their peers. We've even started to see more websites be submitted for the seal. that have different questionnaires almost that the patient can fill out saying, this is where I'm at in my cancer journey. And then they're given targeted education based on how they answered those questions. We've even seen some of those resources start to come through. Regardless of the format of the resource, they all again have to be educational in nature. It must be focused on cancer, cancer care, or oncology nursing to even be considered for the program. There are a couple of kind of exclusion criteria. So resources that can't be considered for the program would be accredited NCPD programs or anything that would be considered promotional or advertising in nature.
So now that we know the types of resources that are submitted to us, let's talk a little bit about what would the criteria be that a resource must meet to be eligible for that seal.
Absolutely. So probably heard me say this a couple of times already, but it must be educational in nature. So that's like kind of the baseline. It has to be something that's trying to provide education about whatever the topic is, whether again, it's that branded resource that's giving education about a specific drug, specific product, or that non-branded resource that might be giving education about how caregivers can support a person with cancer through treatment. So that's kind of first and foremost. The resource must be able to clearly identify who is the content provider and or funder. So if it's a pharmaceutical company, their name must be on there somewhere to identify this is who's providing and funding this content. So I think back when we talked a little bit earlier about how to identify, again, you might still see that on a non-branded resource, the name of the company, but that's more, again, indicating who's providing the content. Next, it must be free of bias. It must be fair and balanced information. For example, with a branded resource, it's talking about a specific drug and it's giving you education about that drug. So what is it indicated for? What are the potential side effects, dosing, or how it's administered? Those things are all fine. But if the resource starts to say, this is the best drug ever and you should only ever use this drug with your patients, that's maybe some bias. So wouldn't be considered fair and balanced. And then that would be a bit of a red flag. The next thing is that the resource must be consistent with current guidelines. So mainly I'm going to be looking at ONS guidelines. So our chemo immuno guidelines, our standards surrounding safe handling and safe administration of chemotherapy. The other thing is our position statements. So really the resource can't conflict with anything ONS says. One example of a resource that I ended up having to not approve was just about administration of the medication, and the way that the nurse did it didn't really follow what we would say for safe handling guidelines. And so unfortunately, I couldn't approve the resource because it would conflict with what we tell nurses is safe handling guidelines and practices that they should be following. Next, the title must be clear. The content must achieve its stated purpose. So on the application that the company fills out, they have to say, what is the purpose of this resource? Like, what goal are we trying to achieve? So if the purpose is to educate patients with cancer about their new diagnosis of lung cancer, that's what the resource needs to do. It can't be drifting off into other topics. The other thing that I'm going to be looking at too is the content formatted and appropriate for the audience? So that's another question on the application is who's the audience for this? Generally, it's one or the other. Either it's geared towards the nurse/healthcare provider, or it's geared towards, a patient caregiver. Particularly when I'm looking at a caregiver resource or a patient resource, is it written in the appropriate level of education? That 4th to 6th grade level of education is kind of what the industry standard tends to be for educational resources. So if I have a resource that's overly complicated, it's using words that wouldn't fit into that level of education, I don't know that I'd be able to approve it because the reading level isn't going to be right for that audience. If the resource has any tables, illustrations, graphics, figures, anything like that, they must be appropriate and, again, understandable by the target audience. So if you have an overly complicated graphic for a patient education resource, it's not really adding to the resource. It might actually just cause confusion. So we're going to be evaluating all of those. Next, I'm going to be looking at if it's evidence-based. Now, for me, when companies submit, if it's a healthcare provider-facing resource, they must have that annotated reference in the resource itself. So the references must be on the document or whatever that the nurse would be seeing. Patient-facing resources, if they were choosing not to include that, the citations in the resource itself, they must then submit their reference list to me separately. And I'm going to be going through that to, again, ensure the references are relevant, they're coming from reputable evidence-based resources, and then that they're not super outdated. Especially I'm looking at things like the NCCN guidelines that we know update regularly. If they're using old versions of the guidelines to support their content, that's generally where I'm going to start identifying that maybe they need to be updating their references. And then lastly, we're making sure that the content is accurate and it's clinically relevant. Like, is this a topic area that's relevant to oncology nurses? Is that what they're saying in the content reflective of practice and reflective of what's currently recommended? It's a long list of criteria, and all of them must meet every single one of those boxes. If any one of those they're not meeting, then that's cause for us to go back to the person who submitted, give them our feedback and say it was rejected for these reasons. The company can then decide if they would like to make changes to the resource and resubmit. And then we go through the list all over again to make sure that they're meeting that criteria.
Wow, that's a lot of criteria that have to be met, but just the rigor that goes through that really then is valuable to whoever's submitting those resources to receive that seal, because they do know that it's gone through a really rigorous process to get it.
Yeah, absolutely. And I think hopefully, obviously, getting this information out to our members and the listeners of the podcast will help them to feel confident, even more confident in using resources that have the seal. Because as I mentioned before, we're hoping we can kind of do this work for you, that we've gone through this rigorous list of criteria and said, yep, it meets this criteria, so that it's a little bit easier for you to identify quality educational resources to use in your practice.
Exactly. So we've been talking about branded versus non-branded, the difference between them. Are branded resources eligible for an ONS seal of approval then?
They are. So they have to meet all of the same criteria as a non-branded resource. I think the biggest ones that I'm going to be looking for with a branded resource is going to be things like, is it educational in nature? Is it aligning with the standards and guidelines of ONS? And then again, is it free of bias? So I don't want something that's going to try to sway the reader more towards their product. It really needs to be just straightforward, factual, evidence-based educational information, branded or non-branded.
So how long does the seal last on approved resources?
Currently, the seal is good for a year after it's approved. And then companies need to reapply annually to get the seal. If they choose to not reapply for some reason after that first year, they then have to remove the seal from their resource. Any of them that are out in distribution need to have that removed. If for some reason in that year span of time, let's say there's a new update to guidelines or an update to the package insert for a certain drug, companies can then make those edits, and then they have to resubmit them to us to be reviewed to kind of keep that seal current. And that's where business development's really helpful for me, is kind of coordinating with these companies to say, what is the change? What's the level of change? Can you mark out where they were in the resource so that it's easy to identify for our clinical reviewer? And then it comes back to me. I do go through generally that entire checklist again with whatever content has been changed, and then we can reissue them the seal.
So I, again, am an oncology nurse that's out in the field working with some patients, and I've listened to the podcast, and I know that Chelsea has gone over these resources and given them a seal of approval. So how can I find or access what educational resources ONS has given the seal of approval to?
On the ONS website, we actually have a seal of approval library, learning library, that includes any resources that currently have the seal and the company elected to include them in our library. So the company is kind of given options when they apply for the seal that we can include their resource in that learning library if they would like us to. A lot of them elect to do that because why not? It's all in one place then. And then there's other things like we can make sure that the chapters, it goes out in communication to chapters that this resource has now obtained the seal. But I think for anybody who's just kind of listening and wants to see where a decent number of ONS seal of approval resources are, would be that learning library. There's several there. And again, a wide variety of topics, that patient specific, caregiver specific, healthcare provider specific resources. So that's where I would start.
Excellent. Chelsea, I just want to thank you for being with me today and talking about educational resources and the work that you do to review things and, the ONS seal of approval. But before we finish up, I always finish our podcast with a few questions, and I'm going to ask those to you now just in a real quick fire manner. So the first one I have for you would be, what are common misconceptions about non-branded and branded patient education resources?
I think the biggest one is, and I've kind of alluded to this a couple of times, is that branded resources are automatically considered bad or they shouldn't be used, and that non-branded resources are considered good. There can be non-branded resources that, while they might not be mentioning a specific product, they might not be good resources because they could just be poorly written. They're not at the right reading level for a patient. And so it just causes them more confusion, or they have clinical inaccuracies in them. So I think that would be the biggest misconception, is that automatically it doesn't mention a product, it's non-branded, then it must be a good resource. I think it kind of has to be held to that same level of criteria for both resources. And nurses really have to be critical of any educational resource and evaluate it based on its content, not necessarily whether it's branded versus non-branded.
What's something about these educational resources that's not often discussed, but you wish people knew more about?
That there is so much out there, and generally they're free. There's so many educational materials available out there, but I think nurses just don't know. We go to industry supported presentations, or we get sent things in the mail, or you get them at conferences. You kind of think about that, but you don't necessarily know that there's websites and printable things out on the internet that you can go get for your patients, or even websites you can direct your patient to that they can spend some time themselves looking around and reading about their diagnosis. There's just so much out there that I don't think nurses are even aware exists.
What additional training or education do oncology nurses need to better assist them in selecting educational resources?
Going back to, I think, what we talked about a little bit earlier is maybe thinking about what are the things that would be considered red flags in a resource's content. In my opinion, kind of some of the red flags that nurses can hopefully be able to easily identify is there any sense of bias in this content? Does this seem overly complicated or convoluted for my patient to give them as an educational resource? Is the resource citing old literature or old guidelines, or this content does not reflect current practice or what I know are current published standards or guidelines? Those would be kind of the biggest red flags. And those would be things I'd want nurses to be able to feel confident in doing when evaluating an educational resource.
And finally, what are some additional resources for patients or providers who want to learn more about this information?
Our seal of approval library that I mentioned would be a good place to start. Not only does the library have the list of resources that have the seal on it, but it also has the criteria and the application process linked on that page as well. So if you're really interested in looking at that, you can also look at that. The other place I would send people is the PHRMA, which is the Pharmaceutical Research and Manufacturers of America. They have on their website a list of codes and guidelines that are really aimed at how information surrounding specifically pharmaceuticals should be shared with both consumers, so patients and caregivers, and the healthcare professional.
Chelsea, again, thank you so much for being with me today and for talking about this information, because it's so important for our listeners, and educating our patients and their caregivers, as well as getting good information and education for us as nurses to continue to learn and to be able to provide excellent patient care, is so important. So I appreciate you kind of giving our listeners that direction and helping us to be able to identify those reputable and evidence-based pieces of material that can be used, and also for the ONS seal of approval program and what that means. But before we leave, do you have any final comments for us today?
I just really hope that this was helpful for any of the listeners who now are going to be able to go out and start searching for some of these other resources that are out there and feel confident in being able to kind of do that initial evaluation to say, is this something that I want to use, or is this not something that I should be using because it has this red flag in it? And my hope too with the seal of approval program is that some of those resources that we put our seal on are really helpful for the nurses in practice taking care of people with cancer.
Thank you for joining me today.
Thank you.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you downloaded your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guests and not necessarily ONS.